So tell me about this patient, 58-year-old woman.
And she has acid reflux, anxiety, pain in the right shoulder. She gets hives, chronic vaginal itching, dry red eyes. She also has, afterwards she told me she has Lyme, shingles, and an inguinal hernia.
Okay. So it's really funny how people say these mild things, and as they're out the door, they say, oh, by the way, I do have a brain tumor. But so possible relationship of hives and red eyes, you know, shingles.
Allergic reaction.
She's in a secondary phase of shingles where she still has some superficial pain.
She's not having pain at this time.
Okay, so she had an outbreak and then now it's gone into remission.
Yes.
You can see with her there's much more normal regulation in the thermogram, and then there's this paradox, which is inflammatory indication in the lymph of the neck, and the teeth don't have any speckled or dotted look, so those are just possibly toxic with materials or reactions to materials or pest. So
she has mercury. She still has mercury in the mouth.
Well, with skin problems and vaginal itching with a degree of mycosis or fungal predominance with heavy metal poisoning, the way out is pretty clear. However, as we look at the thermogram, she doesn't exactly show the classic view of heavy metal toxicity, which would mean that she would have block regulation in areas 3, 4, 5, and 6. She doesn't have block regulation in 3, 4, 5, and 6, only in area 2, which is 15% in the neck, which is really very low. And you can then see the span is not that great of 1, 2, 3, 4, and 5 degrees span. And we do see that there's there's quite a bit of hyperregulation, especially in the kidneys, and she may have this food intolerance sign. But and then she has this thymus that's blocked, which shows overall immune stress, and she has some blocked lymph here in the neck with the viral sign of the ethmoids here, showing that asymmetry, which is the viral sign. She doesn't have the asymmetry in the back or the cubital fossa or perfect. If you want to see what perfect regulation is, here's the example. And she has a little bit of warmer points coming above the baseline in the liver, a little bit in the chest. And then she has the paradoxical thyroid, which is a hypothyroid. Do you know if she's hypothyroid?
She didn't say.
So, but I would have her tested for that. However, you can see more problems in the head because you see all of this is where these head values should be, and you see that a lot of the values are colder than they should be, leaving this space with the yellow background being the ideal, which means brain toxicity. So does she have some cognitive things or foggy brain?
I don't know.
So I always ask when I see so much space here in the brain points, which are the frontal sinus to the CP, they should be coming up higher. The asymmetries are with the ethmoids predominantly, and a little bit with, not really, there's not really a lot of asymmetry elsewhere. And then we want to look at the jaw, where we do see asymmetry of 31.6 and 32.9. So that's a 1.3 degree difference. So you can really see that here. And whenever you see one region of the teeth that's behaving much differently than all the other regions, so you see how most of these regions are in this, say, 33 degree, but all of a sudden all of these points are a lot colder than any of the other points, then we begin to suspect that region, which is the upper right dental. We do see also a big side-to-side difference in the lower jaw, where we're most interested in the coldest being more chronic, and any points that kind of show themselves beyond a doubt, like if all of a sudden this point here we're way up 2 degrees above the baseline or something, that would be a notable tooth. But here we really just see these cold teeth in the upper right. You happen to know what's going on there?
All I know is that she does have mercury fillings. That's the only thing that she was complaining to me about, that she wants to have them. You know.
So when we look in the upper right, we see these 4 teeth here, and the lower right 4 teeth here. And so if I were going to advise her about which ones to remove first, I would definitely choose these colder blocked teeth. You can also, even though there's quite a bit of blocking here, that it's more consistent with the temperatures of the other side, but you can really see that there's a huge blocking of these 2 right sides. So those are evidence that those are the amalgams that need to be removed. And of course, you don't want to remove them all at once, but maybe 2 at a time and wait a month or 2, and while you do a chelation, a gentle chelation. So I think that the mercury presence is a big factor with a lot of these symptoms. The hives, the vaginal itching, the dry red eyes are all symptoms of either gut or systemic irritations from mercury. She has a severe level of toxicity. She has this possibility of autoimmune suspicion. Do you know if she has any autoimmune disorder?
She had Lyme, so that could create a lot of problems. That's all I know that.
The Lyme could also be shutting down her brain points to make them that cold. So we did, we've done some work with Lyme and thermograms and found that there's often a lot of paradox regulation and coldness in the brain points. And here you see 1, 2 paradox points, 3 paradox point, 4 paradox points. So that's kind of a possible Lyme contribution. But I think that the dental is worse than the Lyme signs. And so that's where I would go first, along with the viral of the shingles. And then we see a TMJ or neck disorder. But if you remove amalgams, then there's going to be changes to TMJ as well that she should be looked at in those terms. And maybe does she get headaches?
I don't know.
And the thyroid has to be looked at as well. And then she has this food intolerance and this dysbiosis, which always occurs with heavy metal toxicity. And then she has this toxicity in the pelvic region. Does she have any history of problems there?
Just the itching. And she has an inguinal hernia.
Yeah, that's that's structural. So now we're going to go to the body and show her, hey, we have to work on this lymph. It's possible it's coming from the dental. You can see the block regulation on the right side. I would ask, which shoulder was it that was bothering her?
It's the right shoulder.
So that can be absolutely related to, because there are so many, this blocked regulation is influencing all of the systems that connect through down the neck and then the shoulder. And then the breast, she has 0 suspicion. She has 3 out of 12 criteria, no side difference. She, so that's very clear. She has the distant related focal, which is just a little bit of the lymph and the teeth. I think that one is from the teeth. And then we have the toxicity we have affecting adrenal. There's an autoimmune background, which could be manifesting in the itching and irritation and the inflammation aspect. And then we have the structural implications, and the dental is way up to severe. So I think that has to be addressed. And then checking her thyroid, and then she also must have some sensitivities because of the lungs. When you look at the lungs and you see all of this hyperregulation, you see in area 3 she has 100% hyperregulation. This is showing some kind of an airborne allergy or lung bronchitis presence, which can also be secondary to the heavy metal toxicity, which means there are funguses that grow to try to help prevent the body from becoming even more toxic. So the dental, the thyroid, you always want to help adrenals to deal with the stress of the response and the inflammatory response to get the natural cortisols up. And I think that that's the center of the case really is around the dentistry.